Thank you. Good evening, everybody. My name is Yotam. I work in Madanes. I'm a deputy CEO of Madanes, and I had the medical professional liability insurance, the medical malpractice insurance. I'm Israeli born and raised, and have been in the health market and insurance market for over 20 years. And I'm very happy to talk to you guys, and hopefully, like it was said, that you make Aliyah one day. And my goal is to give you just a little bit of context and some practical advice of how to go about when coming to Israel and starting to work as a doctor from my perspective, which is the legal system, the medical system, the medical economy market. So that's what I want to tell you a little bit about. What I don't, because I saw some of your questions, what I'm not, what I can't answer to is anything about certification or Ministry of Health issues. I saw some people write, I can give advice, but I am not an authority in that respect. These, it's kind of tough with the Zoom, but if you have a question, try and write it, and I'll get to it. So I planned 3 parts. One is as just an overview of the Israeli market and medical market, a little bit about the liability and the legal background of liability of doctors working in Israel, their professional liability. And the third about the market itself, more practical, how private practice works, how doctors make a living. Again, from my side, which I see all the players, since we insure most of the markets, we insure the kupot, we insure the hospitals and the doctors. So we see how things work, and hopefully help you a little bit to understand how you get by when you're a doctor. And I'll try to make it about 20 minutes, and then there's time for questions and answers. I'm happy to answer any questions that you have. So let's start. Israel is basically a public health medical market, which means there's state-owned and operated 4 sick funds according to the National Health Insurance Law, which was passed in 1994, which means that all of the about 10 million residents of Israel have medical insurance, health insurance, comprehensive, which covers them in either one of the 4 sick funds. Clalit, which has about 50% of the population insured under Clalit Health Services, Maccabi Health Services, which is about 25%, and then the smaller ones, which are Meuchedet and Leumit, the smaller sick funds. But each Israeli takes most of the medical services from them, either in the community or Clalit-owned hospitals, or in the state-owned hospitals, which are the government-owned and operated hospitals. And most of Israelis also have a shaban, what's called an extra cover of insurance, which they buy from their sick funds, which enables them to get more services, to choose a doctor, surgical operations, medicine, and so forth. And also about 40% of Israelis have private health insurance. So an insurance that covers them and their family, either from their employer, or they go and purchase with an insurance company that covers, again, surgeries and transplants and choosing your doctor. And this has been again since the 90s. This is the structure of the market. So most doctors in Israel have a morning job where they work either in the sick funds or in the hospital or in other public venues where they get their experience, their connections, their title, and then they have an afternoon job, which is their private practice, which we'll talk about. Doctors are licensed in Israel There's the doctor's ordinance. There's a public health law and doctor's ordinance, and there's an Israeli Medical Association, which most doctors are members of, which is in charge of the board certification. But they received their license from the Ministry of Health. So this is the market. The market has been growing, and the part. Sorry. And the private market has been growing. Israel, as most Western countries, I think, has seen services, a lot of demands for services, and a lot of wait lines in the hospitals and in the community, and shortage of manpower, of doctors and nurses. And this is why, like it was said before, we're very happy to have more doctors here. But this obviously makes the lines longer, and then private medicine grow. So surgery is done privately, treatments, MRI is done privately, and so forth. So this is the current situation. Like I said, in Israel, the sick funds have the infrastructure, or operate the infrastructure of the medical needs. So a lot of the treatments go on in the community, where each member can get a specialist or GP to be tested, and lab tests, and so forth. And then Clalit owns a few public hospitals with ERs and all services. And then the Ministry of Defense, Israel, the government owns and operates another about 12 hospitals, which are like Sheba, and Ichilov is owned by Tel Aviv, and so forth, and Rambam. So all of these are state operations. And then there's what's called the private public hospitals in Israel, which are Laniado Hospital in Netanya, Hadassah Medical Center, Sharet Tzedek Medical Center, etc. And then there's private hospitals like Asuta, a chain of hospitals, the Herzliya Medical Center, Medica, Rafael. All of these are private hospitals, which are being built. In the last few years, there was a few new hospitals, and more are being built. Surgical, mostly hospitals, and private hospitals. And recently, a few years ago, Asuta Ashdod, which is owned by Asuta, but is a public hospital, was opened. And so this is the market. Now, as far as doctors, you are, according to the doctor's ordinance and the tort law, liable for medical malpractice. You have to be registered. Of course, Israel, in that respect, is more on the West European side of regulation. So you have to be board certified and have a license, and you have to see how you are covered for your liability. Where you can be liable is either treating a patient in sick fund, or in a hospital, in a public clinic, and then you're usually covered or protected under your employer. If you are operating in private practice, again, you are liable for professionally liable for damages, as in the public, and you have to see that you are covered either by the place that employs you, the private hospital, or bring your own insurance. But medical malpractice in Israel is prevalent, and it's been growing steadily, like most modern societies. Since the late 90s, we've seen judicial development of laws, tort law, and courts enforcing medical liability, medical malpractice liability. We've seen a social development of people more prone to be customers, not just patients, and to sue. And medical developments as medicine gets more modern and the standards go up, and the focus on private information and on informed consent is growing. We're seeing growing numbers of claims and amounts. So a physician is in basic held responsible for any malpractice, which is based on tort law, and basically you are liable when you are negligent or liable, which means that you had control of the treatment, of any treatment, and that you've caused damage that was caused by that negligence, and then you are liable. And like I said, doctors move around in Israel usually, and they have a few places of work. In each, you should make sure that you're covered. So I think that's the context and the market. How do doctors practically, from my experience, work this place? Let me just say that I've been selling malpractice insurance for like I said, and health insurance for 20 years. So I talk to doctors all the time. I talk to their employers. I talk to private hospitals, to sick funds. So I hear and I know what new company works, what group practice was opened, which doctor is doing better, which doctor is working less, and so forth. So that's where my advice is coming from. Of course, you'll hear from doctors and employers, and you get a lot more information. But this is from my side. Like I said, most doctors start in the public, in the sick funds, and the hospitals is where most doctors do their stage. Is in hospitals, and some of it in the community, but most is hospitals, which has a lot of lines. But once they get into the public, to either a community or hospital, sorry. But they work their day job where they are either employed, so have all their employers' benefits, have an employment contract, and paid a salary, and that's what they do during the day. Like I said, this is one of the places where you meet other doctors, you make connections, you understand who's doing what, and you also can have a title of a clinic manager or a ward manager and so forth. And so they cover you for most of what you need, and they cover you for your medical liability and health insurance and so forth. So that's where usually doctors start. Others work in other operations of the state or public, or in public or private companies, like home visit companies, telemedicine companies that provide primary care, or of course the cosmetic area, which some doctors can start with, which has been growing nicely in Israel as injections and cosmetics treatments, or geriatrics and rehabilitation and so forth. These are the kind of day jobs that the doctors have in Israel. And then there's the private practice. The private practice means the work that you do for either insurance companies, for the sick funds, or for private out-of-pocket treatments. But most Israelis will have either a complementary insurance from the sick funds or a private policy of health insurance, which can finance the services. And the way to do it is, again, usually doctors start with either working for a private hospital or a private company or a private group practice with their department managers and so forth. But this is evening work, which is usually done in a doctor's clinic or in private hospitals at the evening, where initially you can see patients from the complementary insurance of the sick fund, where you give second opinions and expert checkups, and then or surgical work, which is done in one of the private hospitals. In these areas, when you start, you have to be careful the type of contracts that you write and the type of employment that you do with all these private bodies. So with a private clinic or a private network of treatments, or the private hospitals. There you're more of an independent, you're not an employed, and you have to see that that you are covered, and that as far as not just as far as the medical malpractice, but everything as far as what money you're supposed to pay, what is your liability, what happens in case of damages, and how you're employed, so forth. I can't get into the salary and so forth, but just have to make sure by looking at the contracts and understanding the contracts, which is something that sometimes doctors don't do, or consulting with an expert or a lawyer to see the contract that you're signing into. Of course, if you're employing people, it's even more important. But when you don't really know the market, I always say that you have to choose your employer well, and you have to make sure that you are guarded and that you have control, and that you're not left alone if something happens. And then, so this is the basic market, which is doing the daytime work in the hospitals and the evening at private practice, which the types of work is that you have is doing all the surgical work, of course, where people can choose their surgery, or you can work for a hospital and get your surgeries from them. And then the next phase probably is to try to get to a list of suppliers for one of the sick funds in the health insurance companies. In Israel, there is a regulation regarding private practice that says that as far as the money going between the patient and the doctor, which says that you have to be, in order for a patient to see you privately, you have to be on a list of a private insurance company or one of the sick funds lists as suppliers, and the money is paid directly to them. So you have to get into that list, which takes time and connection, and then you can see patients. So this is an obstacle that you probably will have to go through to get on one of these lists. Once you're a specialist, of course, and then you can see their patients. This is once you're on the list, you can see patients. But if you take patients to do surgical work, the salary is paid directly to the hospital. So basically, there's supposed to be no direct payment via private insurance or health fund insurance to the doctor. You are also limited by seeing a patient in the public clinic and then seeing him in private practice. You're limited by 6 months. And so this constructs the private practice. So you have to be on one of these lists, or work with patients who pay out of pocket, or work for someone who has a contract with Maccabi, let's say Maccabi Shaban, Maccabi Gold, it's called, or Clalit Platinum, and work for one of these doctors. So that's the market and the way it usually works. As far as the insurance, I would say that most doctors are insured for their professional liability, the medical malpractice liability, through the sick funds or the state, where if you're an employee, you get insurance cover for your day work and for your private practice. You have to make sure that you see a confirmation from your employer that you're covered, and that you realize what's covered and what's not. And you have to see that each place you walk into in your private practice, you are covered either by your own insurance or their insurance and what the contracts say. You could also, if you're not employed in one of the public markets, you can purchase your own policy that covers you wherever you go, and or you can, when you go to to work for a clinic, you have to ask for them to cover you and see in the contracts that you're covered, and make sure that you're covered, that the place is licensed and it's operating according to their license. So, like I said, be a little cautious in the beginning. If you're not, again, if you're not working with the public, you can get your own insurance. And I think that's about it from my side, of how the market is constructed and how doctors try and see and do a private practice. So I'm happy to answer questions. I saw some of your questions that were sent to me. One is about us to talk about the cosmetics area. As you probably know, cosmetics, light cosmetics and surgical cosmetics and injections. And it's been growing very, very fast in Israel. A lot of the words and a lot of physicians are giving these services. In general, for doctors in Israel, if you have an MD, you can do injections of temporary fillers, so hyaluronic acid and Botox and so forth, and you're allowed to do any cosmetics that the cosmetic device allows it, or that is allowed by the Ministry of Health to be done by MDs. Of course, dermatologists and plastic surgeons can do all surgical activity. The surgical market is either what doctors doing, having their own private clinics, renting in a clinic, or there are several chains of services. There's Proportia and American Laser and Care that have networks of clinics where they provide cosmetic surgeries and employ a lot of physicians. All of the sick funds have in their complementary insurance, Clalit Aesthetics and Maccabi Aesthetics, chains of clinics, which doctors that will speak from the sick funds might say, and they're always hiring. So that's always a good place to start if you're looking for work for their aesthetics clinics. Or when you get a name to hire to rent a clinic and get patient privately. Cosmetics in general is not covered under the health insurance, so it's out of pocket money. Let me see some of other questions. Someone asked about private practice for psychiatrists. Of course, there's wide private practice for psychiatry and psychology. Again, most doctors get their experience and their day work in one of the psychiatric hospitals or wards, or in the community as a psychiatrist for one of the sick funds, and they have their own clinics, or there are large, again, network clinics of providing psychiatric care. Psychiatric in general is not covered under the insurance health, so it's either state provided by the state or provided privately. Psychology is already covered under the national health insurance. Let me see what else. As far as medical records, medical records are not unified from private clinics to health clinics to health funds and hospitals. None of the hospitals are connected with each other except Clalit hospitals, which are somewhat. But a lot of times you will not have a patient's file on a system, not even from different hospitals. So a Rambam doesn't see Ichilov, and a patient has to take care of the system itself. And medical records is a problem here, and I think in a lot of places.
Yotam, we have a question on the chat. What about private practice for psychiatrists?
Oh, I think I just talked about that.
Okay. Okay.
ENT.
Yeah, ENT typically, without surgery.
Well, this is where I can just give my opinion. I don't know a lot of the amounts, but ENT in a sick fund will actually make pretty good money because there's so much shortage. I think that a board-certified ENT can get 40,000 shekels if he works full-time for a sick fund. If there's no surgeries, there's much less private practice, but you can also see patients.
Is it worth in to work in a term before starting residency?
Well, is it worth? I don't know the terms, but yeah, term is a big primary and emergency medicine network, which some of it is also connected to Ichilo, which is a hospital, and it's emergency care, and it looks like a very good school and a good big and stable company. So I would recommend it. Yeah.
Thank you. Dr. Elbaz is asking the question is, what is the amount of the assurance?
Of the insurance?
Mm-hmm.
Well, I can tell you that in certain professions, claims are in the millions. Most of the doctors are either 10 million or 20 million shekels per claim for the insurance.
Are the medical records of public and private spaces unified? The insurance for civil responsibility, while we do not have the recognition of the title in Israel and we already live there, should we maintain it to be covered for acting as good Samaritan?
Yeah. Yeah. Okay.
Can we intervene as doctors in these situations in Israel, even though we still do not have, the recognition on the title? The health system in Israel is consistent with the patient's take care of the doctor-patient relationship, or is it a system where time is of the essence?
Okay, well, first for the Good Samaritan Acts, I think it's like all over the world, you have to be covered for somewhere, and you may be sued for your activities in Good Samaritan if you are a licensed doctor. If you're not licensed in Israel, you're just like a person helping, and the amount of liability as a doctor is very diminished. I can tell you from my experience that we have almost no claims of Good Samaritan Acts, so not to worry too much about that, but you should know where you're covered as far as insurance for your Good Samaritan actions that may arise. As far as the systems of the public systems and how it works, yeah, public systems are at the times is of the essence. You have a lot of patients and very few minutes per patient, and you have to operate the systems and so forth. So it's a public medicine, as you probably imagine it, but it's a very good school, and the shortage of physicians means that sick funds in general are paying very well for it.
Okay, thank you. Igor is asking, Ima sent me to residency Itmachut, how to search a place for the Itmachut. So I will please answer that, and then you can add, of course, Yotam. So in Gvahim Medical, one of the things that we are trying to do is definitely help you guys in finding a place for Itmachut, Istaklut, and the job after. The way we do it is through personal connections and by connecting you to a mentor. Not always we have a mentor, I admit, because we are, as Rachel said at the beginning, we are a young program, and we are building it. And yes, I do have already 20 mentors, but sometimes it doesn't cover all the specialties. So we are on it, we're increasing. So please, Igor, just send me a personal mail. We'll talk on the phone. We'll definitely try to help you specifically for your case. Yes, the answer is yes. Yotam, if you can add, please.
Well, there's certainly a line for a residency in hospitals, and most of them are booked. And what you do is you can be let's call it the outside volunteer or outside doctor, which works in the department, but without a residency, hoping to get a slot when it opens. There is a move to make residency available in the community, so to increase the numbers, but I don't know about that. So appear to be in line, I think, from what I know.
Thank you. Anna. Hi, everyone. First of all, thanks a lot for the very important info that you provide. You're welcome. My question is regarding my specialization in Russia. I worked as an interventional cardiologist more than 40 years. Regarding to the professional insurance, is it possible to restart it in Israel just with a medical license, or is it necessary to re-get the specialization cardiology before, or is it obligatory to get fellowship?
I'm not sure if it's, I don't know if it's obligatory to get fellowship, but you have to do relicensing of the specialty, of course, in order to be covered.
Anyone else?
No, it's really interesting because it's that maybe when we make Aliyah and we know that we will have to do or some paperwork or study or take an exam or make an istaglut, we think about the medical part, but the legal part in Israel, it's like it's really unknown for us, and it's really useful to have this kind of resources and even learn in what other places we can reach this kind of information regarding the laws, the legal framework. What do you recommend us? What pathway you recommend us to take in order to learn more about the laws regarding the medical professions and the rights of the patients?
I could recommend firstly the Israeli Medical Association to be a member there and use. They have information and guidance about your law, and there are a lot of lectures that we do and that other bodies do also in universities. But it's very important to understand, like you said, what are your risks when you go out and what is expected of you. Most of the laws are on the internet, and you can read. And I will also send for you guys like an overview of the legal system. That's like a more detailed Word document. It's just an overview of what kind of laws, what's the kind of heads of damage, what are your liability, what is expected as far as informed consent, and medical records and so forth.
Yeah.
Thank you so much.
For Russian speakers, there's also a lecture on the 11th of September of one of our advocates, Orit, which will talk more about the medical legal aspects. So what you need to do, how clinics are licensed, how dentists are how physicians are licensed, and so forth.
Thank you.
Thank you so much.
I heard that it's almost not possible to get a job in dermatology. What do you think about it? What do you suggest one should do to increase his chances? Dermatology.
If you're certified, like I think that the places where you have the best chance to get in are the communities of the sick funds. Probably you have to go out of the center of Israel, or other public clinics, and the hospital. So the public market is probably where you have your best chance. There are private companies that do medical tourism, but it's less now that they would love doctors with foreign languages. And there's the primary care, like someone's talked about Terem, the private primary care, night centers and so forth, where you can find the initial job.
Okay. Igor has a very popular question, which I'm not sure Yotam, and I wish you could, but I will add from my side. May you advise on a good way to learn medical Hebrew? I appreciate for any advice. So I will start from our side. Basically, okay, every 3 to 4 months, medical ulpan is or should be open in the big cities. Unfortunately, the dates are not published on the site of the Ministry of Immigration, משרד העלייה והקליטה, not because they don't want to, it's because that they will not open a group if they don't have the minimum of people, okay? And also, sometimes there is a lack of teachers. So what they promise me, and I'm in touch with them all the time, is as soon as they have groups and they open, I will be the first one to know, and I will share this information with you, I promise. I'm almost every month talk about that and ask them for dates. So this is from that point of view. I know a lot of, not a lot, but I know there are some options for people, like for example, in Argentina, there is this nice lady, teacher of Ulpan, she have online medical Ulpan. I'm sure there are teachers here also in Israel that do that. But for the regular one and the one from משרד העלייה והקליטה, the next one should be open in October, but they don't have a date exactly. As soon as they do, I will share it. Now, if Yotam, you can add to that from your own experience and knowledge, please. I will be happy to hear.
I don't know of a school or something. Most people, I think, learn it in the hospital. No, I don't really know about the school of medical Hebrew.
Okay. All right. Anyone? Can we do general Ulpan and medical Ulpan at the same period? Well, the medical Ulpan usually is in the morning. So if you are lucky and in the same city or nearby, you can combine an evening afternoon Ulpan and then go to the morning medical, then yes. But if you choose both of them in the morning, then obviously it's impossible. Now you have to know that to join a medical Ulpan, you need to have the teuda, the records of finishing Ulpan Bet. Otherwise, they will not accept you. But this is something to know, okay? Finishing Ulpan Aleph is not enough to be accepted in medical Ulpan, okay? That's why one of the recommendations that we always say is start to learn Hebrew from your own country, okay? In any way that you can do. Private lessons, TV shows, listening to that, speaking to your community, anything, because the more Hebrew you will have, the easier it will be to get advanced Ulpan here. You can even start maybe in Bet, and then you save time, especially if your Aliyah is in a 6 month, 8 month. Think about it. There's a big difference joining an Ulpan in Rama Bet than starting from zero, especially if you're a doctor, okay? How many months is the medical Ulpan? I think 3 or 4 months. It's a little bit less than a regular Ulpan. תודה, Yotam. Thank you, Yotam.
Thank you, guys.